come to the big discussion that we're doing today, which is on the lockdown. Now, let me be clear right up front. As of now, as of today, there is no announcement of a lockdown anywhere in the country or in Maharashtra. By lockdown, I mean the stringent sense of restrictions that we saw last year or any other version really of lockdown. But the fears are abounding. This is because of a series of statements that came over the weekend, series of news reports that came over the weekend, quoting several ministers in the state of Maharashtra's government. We also know that the Chief Minister, Uddhav Thackeray, has been in a set of meetings today to hammer out the contours of what a lockdown would look like if one is required, whether there will be any financial aid granted and what would be the shape of that financial aid. But this is all in the realm of possibilities. So if you are seeing forwards claiming that there is a lockdown for sure, that is not true. As of this moment, there has been no announcement. Nevertheless, I think it's important to discuss why this option is being looked at again and whether it's the only way forward. So the markets, of course, were jolted into shock with news of a possible lockdown in Maharashtra. Sensex tanked over 1,700 points, even if there is a lockdown, it will be limited just to the state of Maharashtra. But there was a sense of panic. India Inc. has come forward and said that it's not the right move. There shouldn't be a lockdown. There are reports that other states may be considering similar action depending on the rise of cases, which are quite out of control. So should we have this as an option right now? Is there no other way? To speak on this, I am joined now by Partha Mukhopadhyay from the Center for Policy Research, Ashok Saigal of the CII's National MSME Council. Important to get the MSME voice because they're going to be most hit if there are further restrictions, and D. Prabhakaran, Vice President Research and Policy at PHFI. Welcome to all of you and thank you for speaking with us today. Mr. Mukhopadhyay, I just want to get your view on this whole cycle we seem to be going through. And to be fair, it's not just us, it's happening in many parts of the world where you open up to give a breather to economic activity, it leads to a spike in cases, and then you clamp down to bring back cases. Do you think this is the only way? Is there no escape from this vicious cycle?
All right. There is definitely, and fundamentally, what you need a lockdown for is when your health capacity is being exceeded. And currently, if you look just at the numbers right now, in places like Pune and in Mumbai, you do see that ICU beds are touching about 90%. But that's just the existing capacity. It's possible to, of course, bring in more capacity. And that's, I think, the first thing that the government should be and most probably is working on, to raise the ceiling so that you have more capacity available for patients to come. So, but at the rate at which we are moving currently, it is possible that you might need some restrictions in order to ensure that the caseload that comes into your ICUs is lesser than what the capacity is. And if so, what is immensely important is that whatever is done in a predictable and time-bound manner. You don't need indefinite lockdowns. Our first experience was one which sort of kept on going. And obviously, there will be severe disruptions, especially in the informal sector. So in order for that sector especially to plan, it's important that what is done in a predictable fashion. And it's quite possible that it may be, one may be able to do it while retaining
I think I've lost your voice again. We'll try and fix that. Meanwhile, let me go across to Mr. Prabhakaran. You know, Mr. Prabhakaran, some believe that the imposition of a lockdown is just a lazy option because You haven't planned for the medical infrastructure to be in place. You haven't planned to ensure that social distancing and masking continued even as the economy was opened up. You found yourself here, and now you slam the doors shut and say, chalo, let's lock down, try and break the curve. How do we make sure that this cycle is not unending?
Right. I think it's one of the most challenging things in this epidemic. Even if we were to impose a lockdown, the benefits of that lockdown to come up may take another 1 or 2 weeks, because the incubation period of this virus is around 14 days. So if you actually try to stop the transmission, it will take another 14 days for the effect to come up. I think short of that, there are many other things that need to be done. Number one, as my co-panelist, Mr. Chattopadhyay was saying, we need to ramp up the health system has been ramped up, but there are specific areas in the health system that need improvement. For example, supply chain, oxygen supply is extremely important, because that is one of the things which is going to save life. Some of the essential drugs, steroids, remdesivir, and so on and so forth, needs to be made available, at least in areas which have very high burden of COVID. The third is, in short of lockdown, why not close schools? I mean, schools, examination closures, and so on and so forth can be done. The next thing is micro containment. Wherever there are cases, try and create micro containment zones and try decentralized lockdown rather than a lockdown across a whole city or a whole state or the whole country, which is going to be the issue of, again, the question of lives versus livelihood will happen. Last thing is about the exams. I think we need to take a call on the exams as to whether we need the exams now, because one of the biggest sources of spread now is from the young people. That is, people who are going to work, or people or the kids who are getting the infection from the schools.
As Maharashtra is concerned, the exams have all been postponed.
Oh, I see.
But as far as Maharashtra is concerned, the exams have all been postponed. The state minister made that announcement today that 10th and 12th standard exams will be postponed. And she's asked that the boards out of the state board, like the ICSE, CBSE board, etc., also follow suit and postpone the exams. My question, this is already done. The micro-containment zones you're talking about has already been in place since quite some time, at least a couple of weeks. Most stringent restrictions have been in place in the state since at least a week now. You're beginning to see perhaps the impact of numbers, but the fact is that you're going ahead with more testing, leading to a shortage of kits. You are still short in your beds, your oxygen, your drugs, remdesivir, etc. How is a stringent lockdown going to help that?
Right. See, stringent lockdown will definitely help, in the sense it is going to postpone the peak. If ever there is going to be a peak very quickly, it's going to postpone the peak and actually reduce the pressure on the health system. But the problem is, it's again going to lead to a big collapse in the economy. So you have to take a balanced view of that. But one of the things which we have missed is behavior change communication. How much have we actually concentrated on providing that communication in terms of COVID appropriate behavior? People have just taken it very easy. They're not wearing masks. Even if they're wearing masks, they wear it halfway. They don't cover their nose. They just cover their chin. And social distancing has been hit very badly. The political campaigning, the festivals, so on and so forth. Social distancing has been given a go by. So all these things are extremely important, and we have failed in our behavior change communication.
Mr. Saigal, from industry's point of view, and that too from the MSME point of view, how do you see the possibility of further restrictions? As it is, some restrictions are in place on the retail end. So all your non-essential stores have been shut, and you have only food, grocery and chemist, etc., a certain category of essential stores which are open in the state right now. Do you see the fear of this possibly extending, and what will it mean for this space?
Tamanna, I thank you for this opportunity to speak what the MSMEs could be affected, and I think the fear is they could be very badly affected, especially the micro sector and the unorganized sector, many of which you have identified, which are the retail stores and so on. But let us also recognize at this point in time that there is a clear distinction between the unorganized sector and the organized sector. As far as the unorganized sector is concerned, I think that shutdown would affect a lot of people, but it is also perhaps the source of a lot of the spread of infection today, whether it is the casualness of approach in shops where any number of people are being allowed in, and restrictions and rules have been, guidelines have been given that don't allow more than 3 or 5 persons at one time. The other end, look at the markets. You see the number of people in the markets, whether it's a vegetable market or it is just a shopping market like Lajpat Nagar in Delhi. The number of people there is very, very large. As Dr. Prabhakaran has pointed out, not only are the numbers very large, but there is no discipline in the way the people are gathering. Now, contrast that with what I said is the difference between the unorganized and the organized sector. In the organized sector, we've been through this lockdown. We have all developed standard operating procedures, which I think most of us did implement as seriously as we could, which included testing the workers when they came in, preventing unnecessary grouping and interaction, and educating them, most importantly. And I think I speak for a lot of them when I say that even in my company, we have once again started creating a lot of awareness that the worst is not behind us; it's probably ahead of us. So once again, we are educating, and I think the organized sector is in a position to enforce far more discipline than the public at large.
Ask you very specifically, one minute, Mr. Saigal. Everyone is educating everyone. I'm sorry, I must come in because I'm hearing from this panel that people are to blame, people are crowding, but people have to go buy vegetables. People have to go to the markets, and people thought as of 2 months ago that the worst was behind us. Today we're saying that the worst is in front of us. My question is, if there is another set of restrictions, what kind of support would you expect this time round from government, be it centre or state?
I think the support we want is mostly related to giving us enough advance warning not to bring it on abruptly. And the fact that Maharashtra has said that it is considering allows people to build up their responses to it to some degree. One of the examples is that there is an unfortunate outflux of migrant workers from Maharashtra, and I don't think that is a bad thing. If there is going to be a lockdown, and these people are going to be locked down into the chawls or the small huts and paying guest accommodations they occupy in and around Delhi, 8 people locked to a room, they're in close proximity. You compare that with what happens in a factory. Now, also when the last lockdown was there, and you look at the lifting up steps, many of the factories arranged a good accommodation for their workers in nearby areas so they did not have to take overcrowded public transport to reach work. As far as you mentioned about people have to go out and buy vegetables, I think what we saw in the area around our factory was that the local people themselves set up hours that the market will be open for a certain time, and they ensured that too much crowding did not take place at one time. So these kind of steps are social steps which can be taken. And I do feel once again that the workers in many of the MSMEs are in a position they can be educated, they can be influenced, and they can be monitored. So I think this is where keeping the MSMEs open would help. Now, no doubt, if we could keep the transport going, which is a major problem last time. In fact, when the lockdown was lifted about a month later, when we were talking in one of our video conferences with members from the eastern sector, the number one problem was not finance, it was not the absence of workers, it was the absence of transport. So we must make sure that transport must continue so that we can get our raw materials, we can ship out our finished goods. I think that is the biggest help we can get from the government.
So that's the thing. So on the face of it, transport has not been stopped, will not be stopped. We have to make sure that smooth supplies are ensured. If a year later we start making the same mistakes, it would really reflect poorly on what we have learned from the experience of COVID-19 all through 2020. We'll wait and watch what's happening on this front, and of course keep our viewers abreast of all the latest. So I want to thank all of you for joining us on this discussion.